Ask the Doctor with Michael Lange begins in 10 seconds.
When it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lange. Sponsored by Lange Eye Institute and Fortifeye Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 877-969-8600. That's 877-969-8600. Here's your host, Dr. Michael Lange.
Testing. Good morning and welcome to Ask the Doctor. I am your host, Dr. Michael Lange of the Lange Eye Institute and Fortifeye Vitamins, here each and every Saturday morning live to answer any and all questions you may have regarding your vision, eye care, and a nutritionally related question. Anyway, I think we're live now. Good morning once again. I am Dr. Michael Lange. You're listening to Ask the Doctor. We're live in the Salem Media Studios here in beautiful Tampa Bay. Remember, this is a live call-in show. It's dedicated to you, the listener, the consumer, the viewer. And remember, it's good morning, good afternoon, and good evening, depending on what part of the globe you're actually listening or watching. And my very welcome guest this morning, not my guest, my co-host, actually. She was a guest in the very beginning, but is Dr. Susan Summerton of Fortifeye Vitamins and the Lange Eye Institute. We got a big day today. We got a lot on our plate. I want to apologize. Last week, I was out of town on vacation with the family up in the Panhandle at Seaside, and we had a great time. I'm back. That's why I'm glowing with a tan this morning. And I also want to welcome Florida Man Radio. So Florida Man Radio in Orlando, that is 103.1 FM, and Ocala for the first time. We're one of the first talk shows on the Ocala station. That's 101.1 FM. That's Florida Man Radio. We want to welcome them to Ask the Doctor. Also, we want to welcome Philadelphia, Pennsylvania, WWNWR, AM 940 and FM 95.3 in Philadelphia. I used to live when I was in school right there on Roosevelt Boulevard. So something called Corman Sweets. I do miss those Philly cheesesteaks. Alexandria, Louisiana, that's 99.7 FM. Shreveport, Louisiana, 1480 AM, 94.9 FM. And then we on a tri-state mega station, WKID, 95.9 FM, tri-state Indiana, Kentucky, and Ohio. Those are all new stations. And I do want to take this opportunity to welcome the infamous Dr. Susan Summerton. Dr. Summerton, thanks for being a co-host this morning.
Adding all those stations, looking forward to all those new listeners. We're happy to take calls and have a great show today.
And Susan, you are one of an elite group of optometric physicians in the country. I think the only optometric physician in the state of Florida that has gone above and beyond in the nutritional arena. I'm a certified nutritional specialist. You became a certified nutritional specialist at the same time with me. Dr. Nathan Schramm, who was a guest on the show 2 weeks ago, is also one of a select group of certified nutritional specialists and optometric physicians, but you've taken it to the next level. You're also, if I'm not mistaken, a diplomat in the American Clinical Board of Nutrition. You're also a fellow in the Ocular Wellness and Nutrition Society. You're the president of the local optometric society. You're like an Iron Woman. I'm going to call you now Iron Mike, Iron Susan, because you're in amazing condition. You're working out. You're practicing what you preach.
We do try to do that. That's for sure. Not only do we every aspect of the health, from what we eat to the exercise to sleep to the whole lifestyle. We know it's not easy because we're out there doing it ourselves, but we also know what matters, what you put in your body, what you do to your body, and even how you think from every day, from the moment you get up, getting that good quality sleep at night, and then just enjoying your life.
Amen. You got to enjoy your life. So exercise is so key, so important, followed by appropriate diet, the right supplements, the right amount of sleep. All of that is synergistic at promoting overall wellness. All right. That's what the Fortify Nutrition Company is all about. You can learn more at fortify.com. Fortifeye. Fortify.com. Or go to 866 503 9746. You can call 866 503 9746. As a matter of fact, Charlene is answering the phones this morning in the Ocala location of Fortifeye Vitamins. And I will be today, probably about noon. I'm going to go to the Fortifeye Nutrition Center in Clearwater. So once again, I'll go there about 12:30-ish. Let's make it 12:30. All right. So 12:30, probably till 3. The Fortifeye Nutrition Center in Clearwater from 12:30 to 3. We'll talk nutrition. You can pick my brain. Usually we have a good crowd that comes out there. And Dr. Summer is welcome to come too if she wants, but she's going to be probably spending time with her family at the beach. A little R&R is always important, but the invitation is always open. So remember, Dr. Lange will be at the Fortifeye Nutrition Center from about 12:30 till 3 today. Also, I'm going to toot my own horn. 2 weeks ago on a Sunday, I entered something called the Whoop Band competition. And I'm wearing one of these things called a Whoop Band. I highly recommend it. It monitors your calories, your heart rate, your temperature, your respiratory rate, your sleep, everything. And I entered this competition with 8,000 people in it, the 60-plus athlete group. I ended up getting 6th place. Now, I won the Ocala, I won the Tampa, I won the Gainesville, got 6th place in the 60-plus. Now, the 60-plus has 8,000 competitors. So it was pretty intense. And the guy that won burned over 9,000 calories. Now, I burned close to 8,000 calories. So another 1,000 calories may be difficult. Let me tell you, folks, to burn 8,000 calories in a day, it's extreme. So I exercised literally from 7:30 in the morning until midnight. I took 3 15-minute breaks to eat and to take a rest. I hydrated with coconut water and sea salt. I drank 3 Fortifeye Fits during the day. All right. I had my omega-3. I had 2 Rejuvenates and 1 Superfood all during that. I had lunch, supper, and breakfast with some carbs, of course. And it was a great experience. It really was. I was pretty sore the next day. Well, I've had 2 weeks off. And so now I'm going to enter the Whoop competition again tomorrow. I'm going to bed early this morning. I'm going to get up at 6 instead of 7 and start this exercise regimen. I'm going to bike for 5 hours, swim for an hour, and then a combination of all sorts of other things, from the speed bag to the elliptical trainer to the octane to the stationary bag to the rowing machine for probably another 7 or 8 hours. Basically, it's nonstop exercise. And, Susan is no newbie to this because she's also into some pretty serious exercise. And remember, we like to say we do practice what we preach. But isn't it true? There's so many good studies out there that showing, now you don't have to do the extreme like I'm going to do on Sunday, but that exercise will keep us healthier and above ground longer.
Absolutely. And amazing. You do put so much energy into that to burn that 9,000 calories, like you're saying. I know how hard it is just to burn 500 calories. I'm a big fan. I'm an Orange Theory girl. And just to get on, we monitor our heart rate, monitor the calories. A good hour it takes to burn those 500 calories. But you're not just burning calories. You're getting the extra benefits of increasing your bone density, your muscle mass, making sure you get your mind involved, keeping your mind active. It helps your brain cells. So it's all about just finding what you like. Just certain studies like diabetics, 20-minute walk after you eat, that makes a big difference. So if that's what you've got, that's the time you can do that 20 minutes. If you've got 10 minutes, do 10-minute walk in the morning, 10-minute walk at lunch, 10-minute walk after dinner. Every bit helps. Just find your starting point and go from there.
It all adds up. All right, we're going to open up the phones. If you got a question, give us a call. 1-877-969-8600. That's 1-877-969-8600. We're coast to coast. And remember, you can see Dr. Summerton and myself at the Lange Institute in the Villages, Florida. The Lange Institute in the Villages, Florida. We see patients 5 days a week there. I'm going to give you the phone number for the Lange Institute. Write this down, 352-753-4014. That's 352-753-4014. Also, I'm going to hold something up called Fortifeye Fit Pro. This is what I took during that whoop competition, but I do take it twice a day. And Dr. Summerton's holding up as well. She takes it. So we take a scoop of this before we work out and a scoop right after you work out. So it's a pre and post workout supplement. It does help with muscle synthesis, strength, and endurance for men and women. I got to tell you, folks, it works. This is the new version of the Fortifeye Fit that I developed 5 years ago. So we've actually taken grass-fed collagen protein and grass-fed whey protein and combined both of them into this, along with something called HMB, MyHMB, Peak ATP, betaine anhydrous, German creatine, the only good creatine, in my opinion, called Creapure creatine, L-citrulline for a vasodilator, and a few other things like vitamin D. And it works synergistically together. Folks, you can go to the website at fortify.com and go to Fortifeye Fit Pro and go to the science section, click on it, and look at all the science, look at all the studies. You know, when we put something together at Fortifeye Vitamin, it's all evidence-based. It's based on the latest science, the latest clinical studies, the exact ratio of ingredients, a milligram for milligram, that is in the studies, not a watered down version. Fully transparent, just like our superfood. Remember, we tell you exactly what's in it. If you turn it over, it tells you how much of each individual item is in it. So I always say transparency is so important. If you buy a supplement and it has a blend, a proprietary blend, they're really not proud of what they're putting in it because they're not telling you, okay? So Fortifeye Fit Pro, if you're an athlete, if you're not an athlete, if you're just over 55, over 65, 75, 85, and you're starting to lose some muscle tone, this is something Dr. Summerton and I see all day long in our clinic at the Lange Eye Institute, is something called sarcopenia. And Dr. Summerton, since we're both certified nutritional specialists, you know, we not only look at the eyes, I mean, we look at the body too, and we try to help people as naturally as we can. And something like Fortifeye Fit combined with an exercise regimen, combined with the proper diet, we can really help these patients with sarcopenia, can't we?
Right. This is not just for the bodybuilders. This isn't going to make you this huge Mr. Universe. This is for health. I noticed myself, and I've experimented with different products. And when I do my workout using this before I work out, it is a lot easier to get my heart rate into that really cardiovascular zone of training and getting the oxygen flowing. And it does make a difference. It does make it less effort to get to the zone you need to be. And then you're also are not eating through your muscle. You're giving the fuel that muscle needs, and you're toning. And you're not going to bulk up by taking it, but you are going to maintain your muscle mass a lot easier and make it easier to do those exercises that you need to do, and increase your bone density with the exercise too.
I got to tell you, you got to try it before you knock it because it does work. I'm 62 years old. To be able to exercise for 16 hours and 15 minutes straight, you know, it takes something like Fortifeye Fit Pro to help. I guarantee I couldn't have done it without this. I took 3 of these during the day. It does increase energy. The peak ATP is the exact chemical structure of adenosine triphosphate, and it doesn't give you any of that stimulant. There's no caffeine. There's no beta alanine. There's nothing that's going to give you the jitters and the shakes and throw you into atrial fibrillation or atrial flutter when you're in the gym or when you're on a bike ride or a run. So think about it. Fortifeye Fit Pro. If you're getting older and losing muscle mass, or if you're, 20 years of age and you're trying to build muscle, if you're a woman or a man, my daughter, Mackenzie, has been on it. Oh, geez. The original Fortifeye Fit since she was, 12, 13 years of age. My mom's 96. She's been on the original Fortifeye Fit for the last 5 years, and now the Fit Pro. So check it out at fortify.com. FORTIFEYE. Fortify.com, or call toll free 866-503-9746. That's 866-503-9746. We're going to talk in a few minutes more about eye pressure support, something we developed to help people that are potentially at risk of glaucoma. And we're going to talk about myopia control. Also very exciting what we're doing at the Lange Eye Institute. But let me give you the phone number. If you got a question, give us a call. This is a live call-in show, and this does not replace a medical evaluation or eye evaluation. So it's for educational purposes only. Call us at 1-877-969-8600. 1-877-969-8600. Also, you can follow us on Instagram. That's Dr. Michael Lang _. Also, Facebook, LinkedIn, X, YouTube. But Instagram's a big one. Make sure I have a blue check. So Dr. Michael Lang _ blue check. There's a lot of fake Dr. Michael Lang accounts out there. So be very careful. Beware. I'm never going to target you and ask, hey, would you like to chat with me in a private room? That's a fake Dr. Michael Lang. So just beware. There's a lot of people getting catfished out there. All right. I want to talk about a product we developed not too long ago called Fortifeye Eye Pressure and Neurocognitive Support. We're using this in the clinic now, and this is something that does not replace glaucoma treatment. It can be used in conjunction. It is mirtogenol and something called Numintix. Mirtogenol is a combination of European bilberry and pine bark extract. Numintix is a brand new, innovative, evidence-based extract of spearmint. And the studies show now that this supplement and the ingredients in this supplement can improve cognitive functioning and working memory, helps your memory. So I'm taking it, all right? It's a unique complex of 50 different polyphenols. It supports focus during the day without disrupting your sleep. There's a lot of things you take out there, it disrupts your sleep. So it actually helps you sleep. It aids in neuroprotection of the optic nerve in the brain. It actually aids in protecting something called the retinal ganglion cells. And there's studies that support this. Increases neurotransmitter levels and promotes neural growth. Supports healthy intraocular pressure. Bingo. There you go. Healthy intraocular pressure. There's many studies, and we've got the studies on the website that show that it can actually reduce the intraocular pressure. And we've seen this in our clinic as well. So it can improve blood flow to the eye and brain. It reduces oxidative stress and inflammation. Remember, it supports memory and concentration. It sounds like a miracle pill, doesn't it? Remember, this is giving you appropriate nutrition to support the optic nerve in the brain. This is not a treatment. This is not a cure. But Dr. Summerton, we see a lot of glaucoma patients. We see a lot of patients that may be a little bit suspicious, and we're wondering whether or not we should put them on a drug or not. Or sometimes the drug isn't controlling the pressure as much as we want, and we want something without side effects. So we're seeing some benefits with this, and it's a natural approach.
Yeah, we're super excited about this product. It's something that, again, we're not worried about side effects. We're actually getting those side benefits to it. And there's a lot of patients out there. We do integrative medicine, so we can integrate this into our traditional treatments of, we use the medicines, we use the eye drops, we recommend the surgeries, but it also works with it. So you can do both together. Or on those cases where you're not really ready for the medicine, but we can see there's signs. We have this new test, it's ERG we call it, but it's kind of like an EKG of the eye. And it gives us a glimpse into the future. The studies show about 3 years out of what we can see happening to that nerve that goes from the eye to the brain. And if we see suspicious on this test, then we need to step in right away and we say, what can we do to prevent this from getting worse? Because with glaucoma, once the damage is done, we can't go back and fix it. So the sooner we get in, the sooner we do preventative treatment, the better off we are. And then we get those added side benefits to it. So it's just wonderful. We didn't have this until now. This is the first time we've been able to offer this. And otherwise, we had just had to watch people until they're ready for medicine. So it's fantastic that we have something we can start early.
We are the only clinic in the world right now that has this. Now, some doctors have started to utilize it. So I should say we're the first. So it's called eye pressure and neurocognitive support. Just simply 3 nutrients that are backed by some really good clinical studies proving that it is effective at lowering intraocular pressure and promoting overall wellness in the brain and the optic nerve. So think about it. Eye pressure and neurocognitive support by Fortifeye Vitamins. Check it out at fortify.com, FORTIFEYE, fortify.com. And you can always call toll free. I'm going to give it to you twice. 1-866-503-9746. That's 1-866-503-9746. 9746. All right, we're going to open up the phone lines. You know, anytime it rains here, people think, or it's cloudy, they think, Dad, they shouldn't be calling the radio station. I think they get electrocuted through the phone. That's just not the case. It's not going to happen. So pick up the phones and give us a call. 1-877-969-8600. Also, you Louisiana boys and gals, give me a good recipe for your jambalaya or your crawfish etouffee. 1-877-969-8600. All right. So a lot of you listening to this program are nearsighted. All right. That means you can't see in the distance. You see great up close. You can't see in the distance. And some of you are extremely nearsighted. I mean, literally, without your contacts and without your glasses, you're legally blind. And so this is called myopia or nearsightedness. Now we have technology called myopia control. And we've dabbled in this over the years. We've done things called corneal refractive therapy and orthokeratology and different things to help slow this down. Now there is an FDA-approved contact lens for kids. That's right. Between the ages of 8 and 12 is what is FDA approved. We can use it later than 12 years of age, and we can use it earlier than 8 years of age. But the studies were between 8 and 12 years of age. And this is a lens made by Cooper Vision that's called MySight. It's a one-day disposable, a type of a multifocal contact, and it reduces myopia. So think about it. Your kids, you put them in braces so they don't have funky teeth, right? Well, wouldn't it be nice if you can slow down their myopia dramatically? So studies indicate that you can, if you're wearing a MySight one-day contact lens, you can decrease the progression of myopia dramatically. And the studies show over 6 years, less than 1 diopter of change. But it also decreases the chance of the axial length of the eye getting longer, which reduces the chance of a retinal detachment and a retinal tear. So, Dr. Summerton, we're pretty excited about this. And we have the whole fitting set. We've started doing this myopia control with this lens. This is going to take, care for these kids to the next level.
It is. And it's another treatment that the sooner we intervene, the easier it is to do. It's prevention again. And the studies are saying by the year 2030, which is coming up soon, 50% of North America is predicted to have that myopia, that nearsightedness. And we know from clinical practice, it's not just about wearing glasses, it's about preventing disease. And once you get, if you have a prescription out there, you might recognize the number of three diopters. Once you get above that 3, then your risk of diseases goes way up with each diopter step. So we don't want you to get to that point. We want to do all we can so that later on life, you don't have to. We reduce that chance of retinal detachments, myopic maculopathies, vision impairments, and even glaucoma. The more nearsighted you are, the more chance of glaucoma as well. So the sooner we can do it, and kids these days, they like to wear contacts. They're pretty easy to put in. They're pretty healthy. They are healthy because they're daily disposable. We know these kids aren't that great at necessarily washing their hands and taking care. We see their bedrooms, how they are. So we want to do all we can to make sure it's clean, it's healthy. They're pretty happy with their contacts. It expands that peripheral vision too, because that's part of the reason they're staring at these computers and they're not stimulating that peripheral vision. And we want to use all aspects of the vision and make the kids happy and keep them healthy in the future.
All right. That is myopia control at the Lange Eye Institute with Dr. Susan Summerton and Dr. Michael Lange. So you can call the Lange Eye Institute and see if your child is a candidate for the new MySight one-day disposable multifocal myopia control lens. Say that 3 times really fast. So we are involved in myopia control of your children. What a better gift to give your child than to slow down that progressive nearsightedness so they won't need Coke bottle glasses. And like Dr. Summerton mentioned, maybe slow down the progression or the potential possibility of certain diseases in the eye. All right, phone lines are open, 1-877-969-8600. Give us a call, live call and show, 1-877-969-8600. I think we're getting ready to take a break. In about 30 seconds here. We're going to take a break, and we'll be right back in just a few minutes for more of the Ask the Doctor. We're going to talk about some dry eye. I see we have a text from somebody asking what is the 4 steps for dry eye that we talked about a few weeks ago, and what is that drop called Rejuvenate? No, I think they mean Regenerate. So what we'll do is we'll actually talk about that after the break. We're going to talk about something called Thermal One Touch as well. All right, we're going to the break. We'll be right back.
There's nothing more frustrating and irritating than chronic dry eye. It never stops. The itching, the scratching feeling, the fatigue and weariness. If you're suffering from chronic dry eye, go to fortify.com and join thousands who've discovered Fortifeye Advanced Dry Eye Therapy, a combination of Fortifeye Super Omega, Fortifeye Focus, and Fortifeye Black Currant Oil GLA. Fortifeye Advanced Dry Eye Therapy works to address oxidation and inflammation in the eye and the entire body. This combination, once only available to patients in the doctor's office, has now become available to you. And already, countless numbers of listeners have found relief with Fortifeye Advanced Dry Eye Therapy. If you or someone you care about struggles with dry, itchy, exhausted eyes, order Fortifeye Advanced Dry Eye Therapy today at fortify.com. That's FORTIFEYE.com, or call 866-503-9746. That's 866-503-9746 and at fortify.com.
While others are hitting happy hour, you're hitting the gym. While they're hoisting mugs, you're lifting kettlebells. You owe it to yourself to get the most out of your fitness regimen before and after your workout with Fortifeye Fit. Fortifeye Fit's power-packed formula is designed to enhance muscle synthesis, strength, and endurance. All evidence-based nutrients in this proprietary formula are well documented and backed in good clinical studies. Taken before and after your workout, Fortifeye Fit is also hailed for what it doesn't contain. No dyes, artificial flavors, or carrageenan. With Fortifeye Fit, you get all you need to get the most out of your workout without needless additives and sketchy sweeteners. Order Fortifeye Fit today at fortify.com. That's FORTIFEYE.com, or call 866-503-9746. That's 866-503-9746. 866-503-9746. And at fortify.com.
All right, welcome back to Ask the Doctor. I'm Dr. Michael Lange with my co-host, Dr. Susan Summerton. We took a little break and we jogged around the block. All right, phone lines are open. Give us a call at 1-877-969-8600. That's 1-877-969-8600. So it looks like Claire from Jackson, Mississippi, has a question through Instagram and wanted to know the 4-step process we talk about for dry eye, and wanted to know a little bit more about that dry eye drop that she called Rejuvenate, but it's called Regenerate. This is an area that Dr. Summerton is an expert in, is natural approaches to dry eye, as well as traditional medical approaches. So I'm going to let you chime in on that.
Right. There's plenty of things we can do, but we want to, again, start off at the basics, where we want to take care of the source of the problem, which is usually originates in the lids. So we want to look at that lid hygiene, and we want to make sure that those glands, we call those meibomian glands, those are the oil glands that secrete oil into your tear film. A lot of people think it's just about the lacrimal gland and getting that water in it. That was the old traditional way of treating it. But now we know a lot of it is evaporative dry eye. So you're making tears, you're just not making good quality tears. So we want to find a way we can increase those better oil productions. So we can heat up those oil glands, and we want to heat it up. You get a warm compress, hot enough to feel the heat, not so hot it's uncomfortable, for a good 10 minutes. Once you've heated that up, that releases and get those oil glands that's trapped, and then you want to clean it off. We have special lid wipes, the Optase lid wipes we recommend all the time in the office. OcuSoft has a lid wipe. Those are great. So you heat them, clean them, and then we feed them. And right here in front of me is what we use. Good quality triglyceride form fish oil. Black currant seed oil is kind of one of my favorites to add on, especially if there's dry skin involved too. That really makes all the difference. They're synergistic. So the fish oil and the black currant seed oil work better together. And then, of course, our Fortifeye Focus, which is our lutein, zeaxanthin, and astaxanthin. The astaxanthin is so good for those epithelium cells. It's also great. I take it every day because it also helps prevent sunburn too. So you heat them up, you clean them, and you feed them. And you just want to make sure you're drinking plenty of water because you want to stay hydrated. You can get your fit, mix that in with water. That's another good way to do it. So it's just an overall way of naturally getting it. And then you can add the drops. So he talking about the Regenerize. Those are those stem cell drops. The man who invented them, he actually runs Scientist of the Year because it's just incredible that he could come up with a drop that can actually rejuvenate. I think that's where she got that word from, rejuvenate the surface. We have Rejuvenate as our excellent tripeptide collagen there, but the drops are called Regenerize. Those are great to use. We use another drop in office. Optase MGD is one of my personal favorites. That helps the oil layer of the tear film. He's showing our Rejuvenate there. That's the collagen, which is also beneficial for our skin as well. I love it. I actually am getting extra hair growth here from, that's the only thing I've changed in my regimen is I switched my collagen to that and my hair is kind of growing more, which is fantastic. And my nails too.
Yep. So that's called Fortifeye Rejuvenate. We'll expand on that in a minute, but it was called Regenerize is the drop. And you can get it on our website at fortify.com, or you can get it at the Lange Eye Institute, the Fortify Nutrition Center, or the Lange Nutrition Center in Ocala. Remember, we do have the Lange Nutrition Center in Ocala. That was my old Lange Eye Care building, and it's right across the street from the Paddock Mall on State Road 200. Two-story building, only two-story building on the block. Go up the elevator, Lange Nutrition Center. Go see Mandy and Mary and Charlene there. They can take care of all your Fortifeye vitamin needs. And we also have some other vitamins there as well. We're getting ready to take a phone call. If you got a question, 1-877-969-8600. That's 1-877-969-8600. Let's go to the phones. Hallelujah. Steve in Clearwater. Good morning, Steve.
Good morning. I found something interesting about the eclipse last time we had it. You know, when you go into your computer, it depends on what internet provider you're using, but it'll come up what's trending, you know, the most common searches all over the country. And what do you know what one of the about 2 days after the last eclipse, do you know what was one of the biggest searches on Google?
No.
Why do my eyes hurt?
Huh.
And that doesn't make any sense because you wouldn't think that people just in everyday, you know, everyday activities, an eclipse would affect because they're not necessarily looking at the sun, but yet it was one of the most common searches on Google. They keep track of this, the 10 top searches every day. And it was like something to the effect of, why do my eyes hurt? Or why do my eyes burn? And I was interested if the audience could think about this and see why they think that could have been. Because you wouldn't think that people just, unless it reflects off water or off building, I don't know. It doesn't make any sense why that would happen.
Well, you know, the solar eclipse, you're not supposed to look at it. And the reason you're not supposed to look at it, it can damage your eye. I mean, we can actually see, believe it or not, a tattoo of the solar eclipse on the back of the retina. Oftentimes we can say, you know, you looked at an eclipse, didn't you? And so it's kind of interesting. But people think, you know, an eclipse, you're having this, what is it, the moon moves in front of the sun or something like that. And you're thinking it's blocking those harmful rays of the sun. So it's not more damaging than the sun because you're not supposed to look at the sun either. So if you look at the sun, you're going to get a solar maculopathy. If you look at the eclipse, you're going to get a type of eclipse solar maculopathy. Okay. So probably looking at the sun without the eclipse is probably worse than looking at an eclipse. Now, I know there's no double-blind, placebo-controlled studies proving this because it wouldn't be very ethical. But the gist of this, you got to look at eclipse indirectly. So I'm not surprised that people have eye pain because they're getting probably a nasty keratitis. That's like a solar burn to their cornea. But worse yet, they can get inflammation in their retina. The retina doesn't have a lot of pain receptors the way the cornea does. but they can get blurred vision. I mean, you can have some significant loss of vision by looking at the sun or looking at an eclipse. So, that's a pretty good question you bring up. Steve, you always got some good questions.
Well, here's another question. If you know how in the morning the sun is orange, and that's because it's coming through more atmosphere and taking out the blue light. Whereas during the day, the sky is more blue, and then at sunset it turns orangish again because you're getting rid of the blue light. Would looking at an eclipse that is occurring around noon be much more dangerous to your eyes than an eclipse that you were looking at 5, 6 o'clock at night? Would the time of day affect the pathology potential of an eclipse on your eyes?
Hi, Steve. I'd absolutely think so, because
Yeah,
as the day goes on, that UV index goes up. And,
right.
around that midday range is when the UV index is the highest. So it would definitely make more sense. You always have that nice, I think it's around 45% of red, which is that
Right.
kind of healthy light. But
Yes.
that UV increases as the morning goes and then decreases as the afternoon goes on. And I think people are aware that they know that the eclipse, I looked as you were talking, I see we've got one coming up April 8th across North America. And people are aware that I think they shouldn't stare at it. So then they're probably a little bit overly concerned when they've been outside during the eclipse. But, you wear the protective glasses and you just look off to the side. And we want to make sure, because if you do get damage to that macula, again, that's something that once the damage is done, we can't get it back.
Well, one thing I think a lot of people, those few hours before noon and afternoon are the worst by far. And one thing we have to realize is if you have like skin cancer and you want to avoid the worst rays, we think of noon as 12 o'clock. But due to daylight savings time, it actually moves at o'clock. The sun is overhead at about 1 o'clock. Plus, we're so far into the time zone. So right now in Clearwater, solar noon is about 1:35 in the afternoon, not noon. And that's something people should consider when they're thinking of push. And one more warning on the eclipse. Believe it or not, as ethical or as unethical as this sounds, there are fake, cheap sun blockers that are out there now that are no good whatsoever. Counterfeits. So be very careful if you're buying something that supposedly blocks from the sun. The FDA came out with a warning. There are fake counterfeit sun blocking glasses out there. So you have to be very, very careful.
I think the best thing is just take a video of the sun eclipse with your cell phone and then watch
Oh,
it
yeah.
later.
Yeah, that'll be super.
All right,
Okay,
Steve.
well, okay, thank you. Have a great week, Dr. Summerton, Dr. Lange.
You
Thanks,
too,
Steve.
Steve. I have an app called D-Minder, and that tells you what time of day, how much the UV index is. And that's sort of helpful too, because if you want to go out there and manufacture vitamin D in your skin, there has to be the UV index to do that. And I just kind of pulled up my app here, and we don't make vitamin D in our skin for another 19 minutes. And that's when the UV index is high enough to do that. And then it also tells you how long you can be in the sun before you'd get that burn. So that's beneficial too, because we all know vitamin D is great for our health as well.
Right. So don't be afraid of the sun. Now, obviously, if you're an albino, you'd be afraid of the sun. If you're on certain medications that make you super sun sensitive, or if you have some sort of autoimmune disease like lupus or something that you got to stay out of the sun, then beware and follow your doctor's advice. But most of us, the lion's share of you guys and gals that are listening, can go out in the sun for at least 30, 45 minutes a day and get some of that vitamin D. That's one of the best ways to get your vitamin D levels up. My 25 hydroxy test on my blood stays about 85. And I try to get, sun, 4 times a week, like Friday, Saturday, Sunday, and Monday, my exercising in the sun. And I don't use a sunscreen. And it's interesting. My mom has had a lot of skin cancers, always used sunscreen. My dad, rest his soul, never used sunscreen. Also, both of them never had any skin cancer. I don't know. Maybe it's DNA. Who knows? Maybe mom got sunburned more than dad did. So the gist of this story, you don't want to get sunburned. So talking about protecting your skin, we talked about Fortifeye Focus having the astaxanthin in it, that is a protectant. It's a carotenoid that not only does the lutein and the zeaxanthin protect the macula from blue light damage, but the lutein and the zeaxanthin also protects your skin, and the astaxanthin protects the skin. That's what gives the orange color to wild Alaskan salmon. So our Fortifeye Focus may not only be beneficial if you're on the computer a lot to reduce accommodative stress and focusing strain and help protect your retina against harmful blue light by increasing something called macular pigment density, but it also is good for your skin. I take 2 a day, and I have not used a sunscreen in 14 years since we developed it. But also the Fortifeye Rejuvenate that Dr. Summerton just mentioned has some protective natures to the skin too. There's some studies out there that show the marine collagen tripeptide also helps to protect the skin against UV damage. So not only do we have a marine collagen tripeptide in here versus a peptide, we have rice ceramides, hyaluronic acid, a dermaval, which is 9 superfoods, liposomal vitamin C, biotin, and a few other vitamins, all in Rejuvenate, 3 delicious flavors, as well as 1 unflavored. So if you're getting your 40, 50, 60, 70, 80 years of age and starting to get that wrinkly skin, hair damage, hair is falling out, your joints are starting to ache, consider Fortifeye Rejuvenate. I've been on it for a month now, and my knee is finally starting to feel better. A lot of you see I've been limping a lot. I've been in a lot of accidents from motocross and things over the years. I got a little arthritis in my body, but the Rejuvenate really is helping me. So consider that Fortifeye Rejuvenate. All right, we're getting ready to take some more phone calls. If you got a question, give us a call, 1-877-969-8600. Remember, Ocala, we're live on the Florida Man Network in Ocala now. That's 101.1. It's a brand new station. So I think this is the first Saturday show. So once again, you can call us from Ocala. Also, we're on the Sky 97.3 FM, and certainly a whole host of stations here in the Tampa Bay area. So give us a call, 1-877-969-8600. 1-877-969-8600. I want to talk briefly about another problem that we have, patients that have really severe dry eye. Let's say you've tried the protocol that Dr. Summerton just talked about, where you heat them, you clean them, you lubricate, and you nutrify, and you still have really dry eye. Let's say we put the punctal plugs in, and you still have dry eye. You have a keratitis. Your eyes feel sandy, gritty, burn, tear, itch. Well, now we have amniotic membranes. These are stem cell enhanced amniotic membranes that we can put on your cornea. They're really very comfortable. It's like a contact lens. We leave them in for about 5 days, and it really has some significant health benefits. And the interesting thing is, we have all the different types. We have the dry ones. We have the moist ones. We have different size, 2-ply, 1-ply, different sizes. We keep all of them in stock. And that really helps us, Dr. Summerton, in helping treat these patients, doesn't it?
It does. And I'm so impressed, the phenomenal healing of what these amniotic membranes do. It's something, again, we haven't been able to offer before, but we keep them in office. And that's one thing. A lot of patients come in and they need them right then and there that day. Well, we have all shapes, sizes in stock that we can apply it, but they are FDA approved. It is amniotic membrane. And you think of it, that's what keeps that fetus nice and healthy. And, if they do surgery on a fetus, they're born without a scar. Well, they're surrounded by that amniotic membrane. And they've taken that technology and that knowledge and made it into what looks kind of like a contact lens, which we love because it heals the surface faster, it's anti-inflammatory, and it makes the patient feel better faster with less chance of scarring. It also stops the lid from rubbing against the eye. A lot of the discomfort is because of that constant friction of the lid against it. So we put that barrier between that. So it's all bonus every time we fit it. And I just love when I get to remove them and see how beautiful that ocular surface looks when I take them out.
So amniotic membranes are available. These are sort of infused with stem cells because it comes from the amniotic membrane. Very simple to apply. And here's the kicker. It's covered by your insurance. So if you've got Medicare, if you got Blue Cross Blue Shield, it's covered by insurance. And we'll make sure it's covered by insurance before doing it. so you don't have an out-of-pocket expense. So once again, think about that. I have somebody chimed in and actually listening to the Florida Man Network in Ocala. He said, coming in loud and clear. Dr. Lange, I've heard you before on the Sky, and you talked about a smoothie to boost testosterone. How appropriate for the Florida Man Network. So that's true. There's some evidence that if you combine certain ingredients, certain nutrients, and you can make a smoothie, it can help your testosterone. So pomegranate juice is one. You've got to get the all-natural pomegranate juice, not the one that has pear and grape juice in it. Doesn't taste that good. It's a little bit bitter, but pure pomegranate juice. Pomegranate juice has been shown to boost testosterone. And you'll drink about 1.5 cups a day. All right. Whey protein. So our Fortifeye whey protein isolate is one of the best ways, the best bang for the buck. This is non-denatured, grass-fed whey protein. Whey protein not only increases muscle strength and muscle synthesis and boosts your immune system, but it boosts your testosterone. An egg. So I use a raw egg, but you can put it in a boiling thing if you're worried about salmonella, and you can boil it for about 2 to 3 minutes, and that kills anything in it. And then you can crack it into your smoothie. And some raw honey, especially raw local honey. And there's a reason for all that. And I think I wrote an article at drmichaellange.com on the blog section talking about this. So pomegranate juice, an egg, honey, and a scoop of non-denatured grass-fed whey protein. And not only is that good for recovery after working out, but it's great for boosting testosterone. And if you're a woman, it's not going to make you big and bulky, all right, if you're not taking anabolic steroids. I don't have my time clock up on my computer, so I don't know about how much. There's the time clock. All right, we got plenty of time. So once again, today, this show has been really honing in on how important it is to exercise and eat properly. So a lot of us will wonder, well, what do I eat? What diet? There's so many different diets out there. There's a paleo diet. There's the Mediterranean diet. There's the keto diet. There's plant paradox diet. There's the hallelujah diet. So I have worked on this for a long time and created something called the Lange survival diet. And the Lange survival diet, I've taken the best of all the diets and put all into one. We've taken out all the foods that have what we call anti-nutrients in them. Things like phytic acid and lectins and oxalates and gluten and FODMAPs. And so if you follow the Lange survival diet, you will be healthier. Your gut will thank you, because Dr. Summit, there's so many foods out there that people consume that cause them to bloat and irritate their gut lining.
Right. A big one is gluten and dairy, and those are typically the two triggers for most people. I know my personal trigger is gluten, and that's what really made a big difference for me, is just being really careful and just not having that gluten in my diet, and noticing the difference in no bloating, less joint pain. You just reduce the inflammation, and you got to listen to your body. Notice what you eat, and then see how you feel after you eat. Food should actually make us feel better. It should not make us bloated. It should not make us feel swollen after. So there's different foods affects different people and different quantities of food. So we're all different. You just monitor what you eat. If it doesn't make you feel good after you eat that McDonald's hamburger or eat that fast food, and you're not feeling that great after, we know we shouldn't be eating it.
That's right. And then a way you can actually make the protein absorb 130 to 160%, believe it or not, take an enzyme right before your protein shake, before you eat your meals, any cooked meals, enzymes. And we do make one, Fortifeye enzymes, at fortify.com. So if you want to improve the efficacy of the amino acid absorption, the protein absorption, you want to digest and break down these amino acids, these peptides into tripeptides and things like that, then take an enzyme before. Also, you can eat a little pineapple before, a little apple cider vinegar diluted before you eat your foods. All of these are little tricks of the trade that may benefit you. Remember, if you'd like to see Dr. Susan Summerton as a patient at the Lange Eye Institute in the Villages, Florida, I will be at the Fortifeye Nutrition Center today at 12:30 in Clearwater. And Dr. Summerton, we got 20 seconds. You can tell everybody goodbye.
And wishing everybody a wonderful day. I'm going to go out there, enjoy the beach with my parents, get some vitamin D. Hi to mom and dad. They're here in the studio. And we'll be going to my son's wedding next Saturday.
Awesome.
Enjoy your day.
Thanks for being a co-host. I want to thank everybody for tuning in and listening to Ask the Doctor. With that, we're out of here. Have a great day. God bless you and God bless America.